All right, so we're going to resume this final part of lecture for chapter 22, care of patients with cancer, talking about the final oncological emergency, tumor lysis syndrome. And if you look at this nice little diagram, you can see all those potassium electrolytes inside the cancer cell. And when the cell lyses or is destroyed, that potassium is released from the inside of the cell, causing hyperkalemia. This condition also results with increased liver production of uric acid, leading to hyperuricemia. So when you see tumor lysis syndrome, you should think of that cancer cell rupturing, resulting in hyperkalemia and hyperuricemia. Let's see what we got here. With tumor lysis syndrome, large numbers of tumor cells are destroyed rapidly, and the intracellular contents of damaged cells, including potassium and purines, are released into the bloodstream faster than the body can eliminate them. Here's an interesting one. Tumor lysis syndrome is a positive sign that cancer treatment is effectively destroying cancer cells. Severe or untreated tumor lysis syndrome can cause tissue damage, acute kidney injury, and death. We know that hyperkalemia is associated with cardiac dysrhythmias that we want to be watching for. The hyperuricemia can build up in the kidneys and block kidney tubules, leading to acute kidney injury. Sudden development of hyperkalemia, hyperuricemia, and hyperphosphatemia have life-threatening effects on the heart, muscle, kidneys, and central nervous system. Hydration prevents and manages tumor lysis syndrome by diluting the serum potassium levels and increasing kidney flow rates. This also prevents the precipitation of uric acid crystals, increasing the excretion of potassium and flushing any kidney precipitates. With tumors known to be very sensitive to cancer therapy, instruct the patient to drink at least 3,000 milliliters of fluid the day before, the day of, and for 3 days after treatment. So this is important patient teaching. Instruct the patient to drink at least 3,000 milliliters of fluid the day before, the day of, and for 3 days after treatment. Some fluids should be alkaline, such as sodium bicarbonate, to help prevent uric acid precipitation. And we need to stress the importance of keeping fluid intake consistent throughout the 24-hour period. Nausea and vomiting can be managed with an antiemetic regimen. We want to be monitoring daily weights and obviously electrolyte values. In addition to fluids, diuretics are given to increase urine flow through the kidney. They're used cautiously to avoid dehydration, and drugs that promote purine excretion, such as allopurinol, are given also. To reduce serum potassium levels for mild to moderate hyperkalemia, the patient may be prescribed sodium polystyrene sulfonate, or for more severe hyperkalemia, IV infusions of glucose or insulin may be given. We're going to move on to the case study and practice questions. So go ahead and pause the video to read through this case study scenario. Now that you've read through it, we'll go to the second slide here to see your provider's orders. Go ahead and pause the video to read through those. Now that you've read through those orders and thought about the rationale, let's see if we're on the same page. So the physician has ordered I's and O's because the patient was admitted with dehydration, and it's important to monitor I and O. Using port for blood draws and IV fluids, when the patient has nausea and vomiting, you often see a decrease in electrolytes from the excessive fluid volume loss. Call for vomiting or temps of 100 or greater. Any temperature elevation may be a sign of infection and should be reported immediately. The D5.5 normal saline is to help replace fluids. Ondansetron, brand name Zofran, is used to prevent nausea and vomiting caused by cancer chemotherapy. Clear liquid diet and progress is tolerated. Clear liquid diet is to replace fluids and to provide some nutrition with decreased risk of nausea and vomiting. CBC, calcium, BMP. When the patient has nausea and vomiting, you often see a decrease in electrolytes from the excessive fluid volume loss. So we're monitoring electrolytes and trying to get a sense of fluid balance. Bathroom or bed rest with bathroom privileges. Because the patient is weak and dehydrated, these restrictions are for safety. Having bathroom privileges is often less stressful than using a bedpan. And then the knee-high support stockings, there's concern for DVTs with prolonged bed rest, so support hose are ordered for the patient to increase venous return and prevent pooling of the blood. Go ahead and pause the video to look through this question. Now, if you chose the answer C, you are correct. Based on the patient's diagnosis, IV fluids should be started. The patient is admitted with dehydration, so the port should be accessed and IV fluids initiated immediately. The provider has ordered clear liquids, but because the patient has been experiencing nausea and vomiting, she may not be able to ingest enough fluids to correct the dehydration. The lab values are ordered for the morning, so they should not be obtained until then. The support stockings can be obtained by the UAP while the IV fluids are started. Go ahead and read this. Pause while you think of your answers. Number 1, the patient is most likely experiencing mucositis, sores, and the mucous membranes. With chemotherapy, mucous membrane cells are killed more rapidly than they are replaced, resulting in the formation of mouth sores. Mouth sores are painful and interfere with eating. Examine the mouth. Number 2, examine the mouth and teeth every 4 hours for fissures, blisters, lesions, or drainage. Document the findings. Provide good, frequent mouth care. Encourage the patient to avoid mouthwashes that contain alcohol. For mouth care, use a soft bristle toothbrush or disposable mouth sponge. Do not use dental floss or pressure gum cleaners. Rinse the mouth with half peroxide, half normal saline every 8 hours. Normally, a patient should drink at least 2 liters of fluid, but due to the patient's nausea and vomiting, this is not possible. Continue to monitor IV fluid replacement. Go ahead and pause this while you think of your answers. A, anemia is 3. Administer Epitin alpha sub-Q once a week. B, neutropenia. 1, inspect IV site every 4 hours for signs of infection. C, thrombocytopenia. 2, avoid IM injections and venipunctures. All right, pause and read this question. If you answered C, you are correct. Chemotherapy-induced hair loss is usually temporary, and regrowth usually begins 1 month after chemotherapy is finished. New hair growth may differ from the original hair in color, texture, and thickness. No known treatment completely prevents alopecia. Pause and read your question. If you answered A, you are correct. Radiation-induced fatigue can be debilitating and may last for weeks to months. The other ones listed there are side effects associated more frequently with chemotherapy. Read this question and then pause to think about your answer. Tumor lysis syndrome, the correct answer is A. Tumor lysis syndrome can be a serious side effect of chemotherapy. It is most common in patients who had large numbers of leukemia cells in the body before treatment. It happens most often with the first cycle of chemotherapy.